Hey guys, Dr. Lera here at Heron Lakes Animal Hospital. So you can tell I am off, not during operating hours right now, hence the t-shirt. The purpose of the video today is going to be talking about pet insurance coverage. If you guys haven't noticed, I have a thing for pet insurance. I think it's a great thing to have. I have it for my own dogs, Ginger, Ruby, and Raven, even though I own my own hospital, but it allows me the ability to go ahead and get them care at the level that I want, which is the top level, without any sort of concern. So if something, God forbid, happens in the middle of the night and I got to run to an emergency clinic or something like that, I don't have to worry. That being said, the purpose of the video today is to review your pet insurance coverage. Now, whenever I talk to people about pet insurance, usually I tell people, don't get anything less than $10,000 in coverage a year. Why? The reason is because if you decide, oh, my dog's young and healthy, I'm just going to get $2,500 worth of coverage, and then as they get older, I'll go ahead and increase their coverage. If something happens, for example, they tear an ACL, which just happened to one of my patients who's 2.5 years old, they had $2,500 worth of coverage, and she blew through the coverage immediately. So now she has to stick with that policy, and if she tries to increase it or change anything like that, it's going to be the ACL on the other leg is going to be considered pre-existing. Now, if you don't know what an ACL is, it's the ligament in the knee. And also, I threw you off a little bit as well because in veterinary medicine, we don't call it an ACL, we call it a cranial cruciate ligament. Okay? Don't worry, there's not a pop quiz at the end of this, so it's all good. That being said, I wanted to let you know, always start higher and then try to decrease your coverage if you need to, because you need to mitigate your expenses. Because that's easy. The insurance company is thrilled to reduce how much money they have to cover, and they will allow you to keep your pre-existing conditions. Versus if you're like, hey, insurance company, I want to go ahead and increase my coverage. They're like, why do you want to do that? Really? Okay, hold on. If you want to do that, cancel your policy, anything beforehand, because they want to go ahead and they want to try and cover their butt. They want to make sure that they're not going to be on the hook for any more money than they absolutely have to be. So if you guys found this video helpful, please like and subscribe. If you have questions about this topic or other topic, you could message us with the word clone, and we'll go ahead and send you a link for a digital mini-me that you can have access to 24/7 from the convenience of your pocket and the comfort of your home, all for free. Thanks for watching, and have a blessed day.